So a partial knee replacement is replacing one compartment within the knee. There are three basic compartments. There's the medial, the lateral, and the patellofemoral. The most common replacement we do is the medial knee replacement, which makes up about 90 to 95% of partial knee replacements. And instead of replacing the whole cartilage and bone in the knee, we would just replace the disease or affected cartilage within that compartment. Well, it's a clinical and radiographic examination that determines whether you're a good candidate for a partial or a total knee replacement. Basically, if your arthritis is isolated to one of those compartments and your symptoms are consistent with that same type of arthritis, you're usually a candidate for a partial knee replacement as opposed to a total knee replacement. Traditionally, the pain associated with a partial knee replacement is a little less than that with a total knee replacement due to some of the soft tissue dissection that we have to do and the manipulation of the knee. The outcomes in the long run are very similar and patients do about the same, but in the short term there's definitely a little less pain and it's a little easier to get through the rehab process with a partial knee replacement as opposed to a total knee replacement.